So let's quickly have the first video that I will be talking about heart failure, right? And in this, we'll be talking about the introduction to heart failure. So this introduction to heart failure, just a brief thing, just have an overview of what heart failure is because we won't waste time because we have like almost 30 videos to make on heart failure, symptoms, everything, treatments, and everything. Okay, so heart failure to me, I'll say that heart failure is a situation where your heart is not being able to pump blood to meet up with the body's demand. Okay, so in heart failure, one of the most significant feature is you have a dilated left ventricle, right? That means like your left ventricle be enlarged. Why will your left ventricle be enlarged? Your left ventricle be enlarged because your left ventricle is the part of the heart that does the most work. Because your left ventricle is responsible for pumping blood to the system, that's systemic circulation. And the whole body is so large, do you understand? So you basically see that um, the left ventricle is basically doing a lot of work. Okay, so you could just see it, all right? The whole thing is just like this. So introduction, we said that heart failure is actually a syndrome, all right? It's not a specific disease, all right? It occurs as a final common pathway in multiple disease states. So in few cases, you will see that the cause of heart failure is not known, all right? In most of the cases, heart failure is occurring due to some underlying disease states and all that, all right? So there are multiple etiologies leading to this final common clinical pathway, all right? And this carries about um, 50%, okay, 5-year mortality rate. That means like if you finally have a heart failure, there's a 50% chance that what you die of it. Okay, so now heart failure is a growing worldwide epidemic that results in significant morbidity and mortality in the aging population. Heart failure is an important contributor to both the burden and cost of national healthcare expenditures. All right, so that's it. Risk factors, but no structural. Okay, this one are just like stages for heart failure. All right, I'll be having a video on that, staging of what heart failure. So this is the introduction. See you guys pretty soon.